So we had a question come in pretty much telling us, okay, Dr. Marble, you talked to us about the difference between calluses and warts, but how do we treat the warts? This is a very good question. There's not one gold standard way to treat a wart. There's so many different things out there. Immunotherapy, there's injecting a piece of the wart back into the area, there's cutting it out, freezing it, burning it, chemicals. The bottom line is there's just so many different wart viruses that are out there, and there's not one gold standard way to get rid of all of them. And so what I do, at least initially, is I start by shaving down the painful callus part of the wart. And once that callus is removed, it's fairly easy then, as we explained in the previous video, to determine whether it is a wart or a callus. And once we've figured out that there is exactly a wart there, then what I do is I apply a chemical to the wart called Canthicur. And what this does is that by treating the wart locally with the Canthicur, what we're doing is we're sending a flag up to the body saying, hey, come down here and treat this. Come down, body, with your immune system and work on this. Because unfortunately what's happening is the immune system has not been working on it up to that point. There's 3 common reasons why a wart will be, your body will not go after it. Usually it's because of stress. If your immune system has been stressed out in some way, then your body is allowing a wart to live in the skin. And so that's stress is number one, but then the other 2 are actually kinds of forms of stress, and that is poor sleeping habits, poor eating habits, the nutritional content of what you're eating. And so the warts then are not getting addressed by your immune system. So you need to be working on those 3 things. That's what I tell all my patients when I see them in the office, is even though we're treating them locally with the wart medicine, the Canthicur that I told you before, you have to be working on your own immune system as well, because unfortunately then it would just be a band-aid, right? You can be susceptible to having other warts develop. So that is what our first line is with wart treatment, and there are definitely other chemicals, there are other treatments that we do in a stepwise approach if that Canthicur application doesn't work. But I would say, in my hands anyway, about 90% of the time the warts resolve within 2 to 3 treatments with using Canthicur and talking about their immune system. So hope that helps. Please make sure that you subscribe to our YouTube channel and give us some comments on what you think of these videos.